Welcome back as we turn to health matters right now. Pregnancy Awareness Week is observed from the 12th to the 16th of February. The primary purpose of Pregnancy Awareness Week is to reduce the number of deaths or complications from pregnancy. The event does so by strengthening the education on pregnancy and fighting and highlighting important issues that promote a healthy pregnancy and safe motherhood. And this morning we are joined by reproductive medicine specialist and gynecologist, Dr. Saleema Nosarka. She takes us through some of the important notes that we have to really highlight. This is, I suppose, should be highlighted every day, but we jump at an opportunity to have an upswing in information, of awareness, and just to get to the heart of the matter. So maybe a good place to start would be with antenatal care. Why is this such a vital focus area?
Okay, antenatal care is very important because it's the place where you get to meet the patient, take a history, find out if they had a previous pregnancy, if there were any problems, current medical conditions, for example, diabetes or hypertension, which can become worse in pregnancy. Is it well controlled? Then you can also talk to the patient about their diet, find out if they're lacking vitamins, make sure they take supplements. If the patient does smoke, smoking is a no-no in pregnancy. Also, alcohol should be avoided. And then also, exercise, I think, is also important in pregnancy. So I think you have an opportunity to talk to the patient, identify risk factors, and then from there, advise how regularly she should be followed up and what measures to take. Also, one more thing, find out about the support structure. You know, is there good support at home, the partner, the family, you know, because pregnancy is not just for the mom, it affects the whole family.
And unfortunately in South Africa, so many, especially young South African women, are going through this journey completely alone, which has its own kind of set of spin-off factors as well. Why is it so important to be preemptive? Why do we need to know this information? Why is it so important to have this health assessment done before we enter into the business end of the pregnancy, if you will? So
that you can plan ahead. You know, if there is, for example, if you know that she's prone to get diabetes, you can control the diet, you can advise on what steps to follow so that she doesn't come in with the glucose levels very high and then it affects the growth of the baby. And, you know, so it's your chance to do something preventative.
And I think it's also really good for peace of mind to have that information. That really is power. From my own experience walking alongside my partner, something I've got to ask you, because it's obviously so prevalent at the moment, and I think a lot of mothers are extremely nervous about COVID. What effects, and I know you've had personal experience with this, what effects does COVID have on your unborn baby?
So COVID itself doesn't affect the baby, it affects the mom.
Okay.
But, and luckily with the whole new, with the vaccines available, I think it's changed things a lot. I personally had the COVID infection in the first wave when I was pregnant, 33 weeks.
Wow.
And fortunately, I wasn't really sick. I just had a bit of headaches. But in the first couple of waves, when patients did have it unvaccinated, they did become quite sick. But as a result of that, the babies were born, had to be delivered sooner because of lung complications. So COVID itself doesn't affect the baby. It affects the pregnancy, and then as a result of that, with prematurity, you know, the baby could have problems.
That's when it can become complicated. You spoke about the vaccine. How should pregnant mothers be feeling about the vaccine? Should they go and get vaccinated right now?
I think there's a lot of uncertainty. People are scared, but everywhere in the world, if you look at all the European, American, British, they all say that you should have the vaccine and you should have it as soon as possible. If you're planning to fall pregnant, you should have it. If you are pregnant, you should have it. You know, just because it will protect you. If you then do get it, it's not going to prevent you from getting the infection, but it will prevent you from not getting very ill, which is what, you know, you don't want to end up in ICU, you don't want to end up on a ventilator, you want to be protected.
And obviously, when you're pregnant, you're limited as to what you can take and how you can treat anything in that space. Are you at a higher risk of contracting COVID if you are pregnant? It might seem like a silly question.
They seem to think that you are at a higher risk, but they also say in the literature that about 80% of people that do get it are asymptomatic. Okay. So, you know, they don't even know that they have it. So I think you just need, and especially if you have a high body mass index, say you're overweight, or if you're older, an older mother, No, we say old, but we mean over 35.
We mean with all due respect, yeah.
Yes.
With,
and then also,
relative,
if you have any pre-existing medical conditions like diabetes or hypertension, then you are also more at risk.
More at risk with that, and that's the case as per normal. If you've got any questions for the good doctor, please let us know. Hit us up on our Expresso Morning Show Facebook page. We are talking about pregnancy awareness and ultimately promoting optimal health within our pregnant mothers and within those unborn children, an opportunity for us to focus on these health matters. We'll continue with that in just a moment.
It's my feel-good breakfast show.
Welcome back. As we continue our health chat, we are focusing on a healthy pregnancy. And of course, this rather crazy time of life, we know that the birth of a baby can trigger a jumble of powerful emotions, from obviously excitement and joy to fear and, yes, anxiety. But it can also result in something that some people might not expect, and that's depression. Most new moms are going to experience to some extent, some postpartum baby blues, if you will, after childbirth. And that commonly includes mood swings, crying spells, anxiety, maybe difficulty sleeping. Well, Dr. Saleema Nosarka is still with us and ready to unpack this very interesting and important topic, because I think it can blindside so many new families at such a critical time where you would think I should be just overflowing with joy, yet I feel exactly the opposite. What is postpartum depression and why does it occur? Why is it so common?
So postpartum, as you mentioned before, postpartum blues or pregnancy blues, baby blues, that happens normally, most people go through it. But it lasts about 2 weeks, because especially if you're a new mom, like you say, the baby's not drinking properly, you're not sleeping, you're tired, you're trying to adapt. The babies want to sleep in the day and be awake at night, and you want to sleep. So that's fine. But then if it goes on for longer than 2 weeks, if you start having symptoms where you don't want to eat, you're not, you're so exhausted, but you're not getting any sleep, you also find that your baby is crying all the time and you're becoming irritable and you're actually thinking, you have thoughts maybe to harm the baby.
Yeah.
You know, that can happen. And also, it doesn't necessarily need to be immediately when the baby's born. It can actually happen, postpartum depression, up until the first year of the birth.
So what is actually going on there? Is it purely the chemicals in the brain trying to balance themselves out again? What leads to this imbalance? It
isn't chemical imbalance, but it's also, there are certain people that are more prone to get it. So, for example, if you maybe had depression early on in your life, if you've gone through very stressful circumstances, like maybe COVID, for example, could be, maybe you had COVID, or maybe you're scared about getting COVID, maybe you lost there was a loss in the family, bereavement can cause, there's psychological causes as well. So it's not just hormonal, it's also, there can be a lot of other causes as well.
A lot of other triggers as well. How does this then affect the mother's quality of life? And as you've highlighted it, it's going to be a challenging time.
Yes.
You start with 2 days of no sleep, and then it's just craziness. And I understand that there is a certain amount of circumstantial kind of influence in that space. But just how much of an impact can it have on mom and on baby, I suppose, to some extent?
It can have a very bad impact, and that's why I think moms, if you belong to if you attend antenatal classes, or if you have friends or family, it's good to talk. And if you're feeling a bit overwhelmed, there's lots of places where you, especially with the breastfeeding, you can go and they can advise you on how to breastfeed, about sleeping, how to deal with a baby, and get help. People always think, I can do it all. And the partner...
You're not failing if you can't.
No. I always say, when you find out you're pregnant, it's a happy time, but no one warns you about what's going to happen when it actually happens and the baby comes. So it can be very overwhelming. And that's why you need a good support structure with a partner, with your family, with your the clinic, the sisters, they can advise as well.
And that's where I think that antenatal journey is so good, because it connects you to a community of people who are often going through exactly the same thing. So going to a good antenatal class, as much as you might think, we got this, it is so helpful from that perspective, because it gives you your tribe, your people around you.
And I think if you talk to another woman and find out that someone else, you see you're not alone.
Exactly.
Because sometimes you think it's me, I'm not coping, I'm a failure, especially if you're used to being in control.
If you're a control person,
yes.
For sure. No, OCD will be that trigger will get pushed and pushed and pushed. When do we seek help? When, in terms of speaking to someone professionally, maybe going back to your gynae to say, okay,
Yes,
listen,
yes.
something is not right. When is it
So if you find
alarming?
that it's getting, some people say you must just, take it easy and whatever. But I think if it's getting really bad and you feel that you're getting these feelings where you want to harm the baby or you want to harm yourself, then you should seek help, because there are treatments available, antidepressants. There are ones that you can take that are safe if you're breastfeeding, and you'll immediately see it will make a huge difference. It takes a few days to kick in, but it will help you. Then there's also support groups that you can join, and you can also call someone just if you find that you're not doing too well.
And I think it's really important to just to echo what you've said, is that you will have these feelings of failure, and this comes from both parents' side. But sitting here with a front row seat to watching this miracle of pregnancy and then the birth, is that you are both going to be questioning yourselves all the time, and that is okay. It is okay to feel like you're out of your depth. Every parent in the history of parenting has gone through exactly that same thing. But if those baby blues, if that postpartum depression is hanging on for too long and is starting to affect yourself and affect the quality of life of your baby, and starting to get you to that place of having dark thoughts about yourself and especially of your little one, it's time to talk to someone. Doctor's going to stick around. We are hopefully going to take some of your questions. Please let us know on the Expresso Morning Show Facebook page. Any pregnancy-related questions, we'd love to hear from you.
It's my feel-good breakfast show.
Welcome back as we wrap up our vitally important chat around pregnancy health and, of course, awareness at this expectant, at this very important time. We know that this can be a wonderful journey, but it also is very stressful growing a tiny human. Well, every year from the 12th to the 16th of February, Pregnancy Awareness Week is observed to educate expecting moms on a healthy pregnancy and journey into motherhood. And we have loved the very informative discussion that we've had with our good friend, Dr. Saleema Nosarka, and she is going to wrap things up now, and we'll hopefully get to some of your comments and your questions right now. I'm going to open this up by saying, when do you need to start engaging with your gynae? When do you need to start getting the plan in place? When is this antenatal journey? When does that officially begin?
Well, I think if you're planning a pregnancy, that's important, but pregnancy isn't always planned. So let's say it's not planned, because if it's planned, then you know.
Yeah, then you're sorted.
But if it's unplanned, I think the minute you find out you're pregnant, especially if you have had previous problems, you should try and get to a gynae as soon as possible, say when you've missed 2 periods, so that you can go and see exactly how far you are. If you book early and you can have a scan, then you'll know exactly the gestation, and then from there, you can plan. Otherwise, if you wait too long and you go later on, then you're not sure, and then you also won't be able to pick up problems with the scans. So I think it's important to, as soon as possible, to go, when you find out that you're pregnant, to go and book. Have a booking, and then you can have all your bloods done. And HIV, I think, is also important. We have to screen, because HIV has become part of life now.
It really is, and our treatment of it is superb.
Yes,
here. So
yes.
I think we need to see it in that way.
Yes, and HIV is not a reason not to fall pregnant. So, because, with the ARVs available, the baby will not get infected.
What are the biggest concerns that you have working in this space? Yes. What worries you the most, and why have you become a champion for Pregnancy Awareness Week? What messaging are you trying to get out there to help as many mothers as possible?
I think when, as a mother, you have a responsibility, you have a little human that you have to look after now. So I think your health is important. And often mothers are, you've got other kids as well. So, you don't take care of yourself. And self-care is very important, because to be able to look after a baby, you need to look after yourself. You need to love yourself. And you have to make sure that everything's okay. Sometimes, when I worked at the hospital, at Tygerberg Hospital, we'd see patients come in and their blood pressure would be sky high, and they would be so sick, but they maybe don't have the money to come in or the resources to come in. And, it's terrible. It's heartbreaking. Because at the end of the day, if the mother becomes really ill, she could potentially lose her life. And this is what you want to prevent. And then the baby's sitting without a mom.
And it is like that. I know we're talking about extreme cases, but that's the reality of where South Africa is right now. I know quite a few of you have weighed in online, so let's take a look at some of the comments and questions that have come through. Let's take a quick look here. This is from Nalima. She's saying, good morning. Regarding the pregnancy topic, can the doctor kindly advise the best supplements, etc., that helps to enhance your chances of conception? So before Bubba's even arrived,
Yes.
And this is, again, going to concern a lot of couples out there. Are there supplements that both members
Mom
of
and
the
dad,
partnership,
yes.
mom and dad, can be taking to help?
Yes, I think a general multivitamin, but I think if you're struggling to fall pregnant, I'm not sure if this is an infertile patient or just a normal patient, because I think normally if you're trying to fall pregnant, people don't really worry until they become pregnant, and then you should take your folic acid, your zinc, your iron so a general multivitamin. But if you're trying to fall pregnant, I think it's important, if it's a man and maybe there's a sperm issue, then they need zinc, folic acid, vitamin E.
Okay.
Yeah.
I think of Pregivits, and I mean, most of those supplements that a pregnant mother needs,
yes,
they're very well packaged.
There's so many different ones on the market, and some of them, it just depends on yourself what you find best.
That being said, what should a mother be focusing on health-wise after the birth? Is it necessary to keep that supplementation up, and for how long?
I think it's good that you, especially in pregnancy, you become anemic. You get iron deficiency anemia. So your iron levels are important. And then once the babies come, it should go back to normal. But you should still take supplementation. You should eat well. You should drink lots of fluids.
Especially if you're breastfeeding. Yeah.
Yes.
Oh, doctor, you've made me terrified to have a baby all over again. Definitely not a third in the cards. But
you never know.
You never ever do know. That's the crazy thing. But I will reiterate, having gone through this fairly freshly, I think we've both been on a similar journey in terms of the age of our kids. You will feel like you are not getting it right and that you're failing a lot of the time. And I'm speaking from the partner's objective, from our position, obviously. But the most important thing is to know that you are not alone. There are others going through exactly what you are going through. Find your community, find your tribe, as I said, and make sure that you form a great relationship with your antenatal team, most importantly with your gynecologist, because they really are there to walk you through this journey every step of the way.